Thank you, everybody. Good afternoon, and thank you for inviting me. Let me just make sure I'm sharing my screen. Okay. Don't know how to minimize. Can you all see my presentation by any chance?
Yes, we can see it. Yep.
Okay.
If you could put it in presenter view, it might be a little bit easier.
There you go.
Yes.
Wonderful. Thank you. That's perfect.
No, thank you for the guidance. Okay, well, we're going to try to get through this as quickly as possible. It is your Florida Laws and Rules presentation. Again, as mentioned, my name is Linda Valdez. I am currently the chair of the Florida Board of Clinical Laboratory Personnel. That is the board in the state of Florida that actually oversees, maintains all of the Florida rules related to our licensees in laboratory. Okay. The presentation will address all the regulations and meaning the statutes and the rules related to your license in laboratory. The main purpose of the statutes and rules in the state of Florida is mainly, the first and most important, is to protect the safety of the citizens of the state of Florida. We want to make sure that all of our lab testing in the state of Florida is done by properly documented, properly educated and certified individuals, thus our licensing program. So the first topic we're going to talk about is Florida statutes. These are what is considered the Florida regulations. Florida regulations related to our profession in the laboratory is found in Chapter 483 under Health Testing, Part 2, where it specifically speaks about clinical laboratory personnel. The statutes range from 483.800 through 483.828. All of the statutes for all of the regulations in the state of Florida can be accessed via online Sunshine website as indicated there. The statutes do make exceptions as to who the regulations apply to or don't apply to. In this case, the exemptions are for any laboratories that are actually operated by the US federal government, laboratories operated and maintained exclusively for research or testing purposes, meaning there absolutely has to be no patient testing performed. So in the state of Florida, just an FYI, there is a very distinct delineation between research and clinical laboratory testing. Research in the state of Florida is very, very specific. There must be no laboratory testing, either clinical or anatomical, that gets placed in a patient chart. The minute that testing does get documented in a patient chart, that is no longer considered research. That is considered clinical laboratory, and those individuals performing that test fall under these Florida statutes requiring clinical laboratory licensure. Not a lot of states have that very distinct delineation, but the state of Florida does. The other groups that are not or are exempt from the Florida statutes related to our licenses are respiratory therapists or respiratory care practitioners, I apologize. And this is specific for blood gas testing. So any testing that they do, obviously for the lab would be related to ABGs or blood gas testing done at the bedside. So they are exempt from these statutes. So a respiratory therapist can perform an ABG, but does not have to be licensed as a clinical laboratory professional. They do have to hold, however, their respiratory therapy licensed in the state of Florida. Also, advanced practice registered nurses who perform provider-performed microscopy or PPMs also are exempt from the Florida statutes related to clinical laboratory. Another exemption that is very important that a lot of individuals do not realize that this is an exemption, and it does come into play, especially when those individuals are trying to obtain a license in the state of Florida and their experience is solely in a physician-owned laboratory. So what a physician-owned laboratory distinctly delineates is a laboratory that is within a practice by a provider, an independent provider, that does laboratory testing solely for the patients that they see in that office or an affiliated office that has the same owner. So nurses who may be working there who are performing moderate complex testing, or anybody really who works in that physician office laboratory do not have to hold a clinical laboratory personnel license because they are exempt under Florida statute. But again, the practice has to be owned solely by one owner, usually the provider, or common ownership, and the testing is done on those patients seen by that particular practice, and no testing can be done on any patients that do not see that particular practice or in a practice that's also owned under common ownership. Florida statutes also have various definitions in order to assist us in trying to understand whether or not something applies to the statute. And the first one is, what exactly under Florida laws does a clinical laboratory mean to them? It includes, as you can read there, a clinical laboratory director, a supervisor, a technologist, a blood gas analyst or technician who performs a laboratory test. Okay, the term does not include, and this is important, trainees, persons who perform volunteer donor screening at blood banks or plasmapheresis centers, does not cover phlebotomists here in the state of Florida. Phlebotomists do not have to be licensed nor certified. Or persons in a laboratory that may be doing the pre-analytic part, sort of our lab processors, is also could include our phlebotomists. They are not covered by these rules, so they do not have to hold a clinical laboratory personnel license. The statutes also define what the Board of Clinical Personnel is. The board is a board composed of 7 members. We are all appointed by the governor and confirmed by the state. The board itself delineates, the statute actually delineates who can sit on the board. There has to be at least one practicing lab director, meaning that person holds a clinical laboratory personnel director license or is a qualified pathologist or a provider that would qualify as a CLIA medical director. There has to be 2 practicing laboratory supervisors, meaning there has to be 2 individuals on the board that hold Florida State Clinical Laboratory Personnel Supervisor level license. And there has to be 2 practicing clinical laboratory personnel. That can be either a technologist or a technician. At least 2 members of the citizenship must also be on the board. These individuals should not have any connection to the profession whatsoever. They are sole representing the citizenship of the state of Florida. All board members do have term limits, but we serve until there is a replacement appointed or we resign or can no longer serve for other reasons. I encourage everyone on this Zoom call to go to the gubernatorial appointment office on website and apply for a position on the board. There are a couple vacancies, and some of us actually have exceeded our term limits twice. So this would be a good opportunity for you to participate in a very important board in the state of Florida and also assist the board in protecting our citizens in the state of Florida and assuring that our profession is being done properly. The responsibilities of the board: obviously, we oversee the biennial licensure of all clinical laboratory personnel who hold license in the state of Florida. That also includes the public health laboratory scientists, what we're going to briefly talk about a little bit later. The board also designates and rules that a national certification exam will be accepted in lieu of state given examinations to obtain license. Years ago, in 1994, the last state licensure was given. At that point, national certification was accepted in lieu of state examination. The board also approves and manages all training programs within the state of Florida and those training programs that are outside of the state of Florida. FYI, if you are a training program outside the state of Florida, you do have to apply for Florida licensure as a training program. Only those sites, only those training programs that are NACL accredited or specifically approved by the board will be allowed to train individuals who will be applying for licensure in the state of Florida. So whenever someone applies for a licensure, part of the application asks if they went through a training program, and if they did, the training program must be NACL's accredited and hold a state license. In the same vein, all the curriculum in the schools and the colleges offering the education training programs go through the board in order to be approved by the state. Competency, meaning through our CEU program, is required in order to do your renewal. So every 2 years, you do have to submit CEUs in order to get your license renewed. The board also is in charge of disciplinary actions, and we handle all violations against the statutes and rules. It is considered a judicial body, so individuals who have violated any of the statutes or rules related to clinical laboratory personnel do come to the board, and the board is able to levy disciplinary actions and fees or penalties. So the statutes are basically the laws or the regulations of the state of Florida. The Florida Administrative Code, or what we call the rules, are how those statutes are actually put in place. So the statutes tell us what we have to do, and the rules actually tell us how it's done. So the statute, if you remember, creates the board. So it says there must be a board of clinical laboratory personnel that do all this. So now the rules under Division 64B3, chapters 1 through 13, you will find the actual rules of the Board of Clinical Laboratory Personnel, and you can find all the rules related to Florida Administrative Code, all the rules of the state of Florida, under www.flrules.org. We're going to go through each of the rules related to clinical laboratory personnel, specifically the board, because again, under statute, the board is created specifically to maintain and oversee the licensure process. These are going to go kind of quick. There's a lot of rules, but basically we're just going to give you a summary of what those rules talk about. The first rule is 64B3, which is the chapter 1.006. Just basically says that if you are a licensee in the state of Florida, you have to maintain a current home address and a practice location. Okay. I do advise all licensees that if you change jobs or move from another state and you come to the state of Florida, and you have a state of Florida license, that you update your practice location. That is really important, because if you don't change your practice location, let's say you were working in Georgia and you moved to Florida and you forgot to change your practice location in the state of Florida, it will still show that you're practicing in Georgia. Does not matter that your mailing home address is in Florida. So very important that you make that change when you come to the state of Florida. 64B3.1008, it actually talks about how often board meetings have to happen. and what the rules are related to make sure that the members of the board actually attend, and the attendance policies. I'm not going to go through all that, but just to say that absences to the board, a board meeting or call, have to be excused by the chair. If not, if they're unexpected or we're not made aware that a board member cannot attend, that is a ding against them. If they miss a lot of board meetings, they may be asked to resign their position. 64B3 1.0085 requires that, as all Florida rules do, that there is a public comment section whenever the board addresses having to create the agenda for the next board meeting. These board meeting announcements are done way ahead, usually a year ahead, and those are posted in the Florida Clinical Laboratory Personnel website, which I'll show you at the end of our talk. 64B3 1.0115 actually talks about there being a probable cause panel that is designated by the board chair. The probable cause panel, as you can allude from what it's called, determines whether a person has violated any of the statutes or rules regarding their license. And that meeting is actually done separately from the board meetings that we hold quarterly. Rule 64B3.2.002 is where you actually start defining the licensure levels of the clinical laboratory personnel licensure system. We have director level, we have supervisor, and we have technologist, technician, and there is a public health laboratory level. 64B3 2.003 is really important, and a lot of people are not even aware that it exists. It's actually at the bottom of the definitions. This rule is just a list of definitions, and the last definition talks about manual pre-testing. You would never guess by the title that this is where you would find where non-licensed individuals, what they can do in the laboratory. So if you are wanting to know what a lab assistant can do in a clinical laboratory, you would go to this rule, the last definition in the rule, and you will see a list of items that a lab assistant can perform. So any non-licensed individuals who want to work in a clinical laboratory, what they can do in the laboratory is defined in this particular rule. 64B3, oh, just a little note there, and I should have updated this slide, I apologize, where it says that there's currently out for public comment. This rule actually was changed earlier last year, and it was actually made slightly broader. So it actually gave non-licensed individuals a little bit more ability to do additional tasks in the laboratory that they previously could not do. And this honestly was in response to COVID, where we needed additional assistance in the laboratory because as we all had issues with hiring. So now lab assistants, or technically non-licensed individuals, are allowed to load instruments, especially, and we're talking about those instruments that are basically turn themselves on, as long as they are not performing the action of starting the testing process or the analytic process, they can load an instrument. We've also expanded the rule to allow them to do basic troubleshooting, nothing to do with the interference of the actual analytic process, but just basic. And I don't even know if people change probes anymore, but if they were, that would be something that they could do now. The definitions in this rule also have always allowed for non-licensed individuals to create slides from a primary specimen. Also, they can streak plates in micro from a primary specimen, so they cannot do any streaking from anything that grows afterwards. But if you receive a blood culture, then they can actually do plate for you. from that primary culture. I mean, that primary specimen, I'm sorry. Once it grows, a licensed individual will have to take over at that point. So I just wanted to make sure everyone's aware of that, because that has actually been in rule for probably a decade. 64B3 3.001 talks about the training programs. Okay, recent changes to this rule actually, like it says there, the programs now have to hold a national accreditation, NACLS in particular. All training programs that apply for the state of Florida are reviewed by the board, before they are given that license to be a training program. Going back to the training program, if a licensee just a reminder, if a licensee does apply for license in the state of Florida, if they attended a training program, but the training program does not hold a state of Florida license, nor is it NACLS accredited, that individual probably will not receive their state of Florida license unless they obtain experience outside of the state of Florida. 64B3.3.002 further explains of the training program personnel, their qualifications, and specifies what a trainee can and cannot do. Mainly, it's really important that everybody understands that if you are in an approved training program, you by no means can report any patient results. So nothing can be in a computer program indicating that this is a trainee putting out a patient report. Okay, that is not allowed. That is considered unlicensed activity. Shadowing, however, does not qualify as training. A lot of people have presented to the board where they're like, well, we shadowed a tech for a year. Well, they're not going to get a license because that is not considered a training program unless where they did the shadowing is an actual approved Florida training program. 64B3 3.003 actually talks about the curriculum that is required by the state of Florida. Right now, if you are NACLS accredited, we don't really look at your curriculum. However, there are still some training programs that do have us review them individually without a NACLS accreditation. That is actually, those are current training programs. Any new training programs must have NACLS accreditation. Trainee registration is talked about in 4.001. Trainees have to register in the state of Florida before they start their training programs. It's basically their trainee license that they obtain. That covers them to complete their training in the training program. 5.0011 is further definitions. They give you all the acronyms that we can think of about our profession. It also talks about the college level academic sciences that are acceptable as if you are applying to the state for a clinical lab personnel license. You must have 6 credits of academic bio, 6 credits of academic chemistry for a total of 24 academic sciences. Now, a lot of people get this confused what academic science means. Academic science is basically those foundational academic courses like Bio 1, Chemistry 2, Organic Chemistry 1. Those are academic courses. Your clinical lab training program courses are considered applied sciences. So they do not count towards the 6, 6, and 24 of academic science that is needed to apply in the state of Florida. So that being said, individuals who go through training programs, again, you might have the training program, but the education still requires that you've had those foundational academic courses along with your training program. 64B3 5.002 talks about supervisor and what the qualifications and personnel responsibilities of these personnel holding a supervisor license, what that means when you have a supervisor license. Now, something that we like to point out, because it does confuse a lot of people, supervisor's license in the state of Florida is not equal to CLIA's technical supervisor, clinical consultant, or general supervisor titles. Just because you hold a supervisor's license does not mean that you automatically qualify for any of those 3 CLIA-defined titles. So please be careful with that. There are supervisors in the state of Florida, meaning individuals who do hold the licensure level of supervisor, that do not have BS or BA's degrees. They only have an AA degree. So under CLIA, they would not qualify as a technical or general supervisor, nor a clinical consultant. So again, supervisor does not automatically mean that you qualify under CLIA for those 3 titles. Technologist level is qualifications and responsibilities described under Rule 5.003. Okay. Current rule requires that the licensee has passed a national certification exam, because the state of Florida no longer offers their own licensure exams. Okay. Rule 5.004 is the technician qualifications and responsibilities. Again, that licensee must have passed a national certification exam. 5.007 is the director level. Okay. This license is for Florida licensed physicians. I'm sorry, I got all confused there. 5.007 is the director level, but this is to cover individuals who are not Florida licensed physicians or providers. Okay. So this covers individuals who may necessarily just have not just have, but have a PhD in a particular topic, but they are not a licensed physician, but they can get a license as a director in the clinical laboratory, and they would qualify to be the CLIA medical director or the CLIA laboratory director. If you look at your CLIA certificate, I apologize for the dog barking in the background. If you look at your CLIA laboratory certification, you will see laboratory director. Well, if a person obtains the Florida license level director, they can qualify under CLIA to have their name on that certificate for that laboratory. Again, if you are a physician, a licensed Florida physician or provider, you do not have to have a separate clinical laboratory director license. 5.008 talks about public health laboratory personnel. There is a slight difference here. The technologist and technician levels for public health laboratory personnel are actually not described under rules, but are only described in actual statute 483.812. So if you are looking for the qualifications and responsibilities of a public health technologist technician, you would actually have to go back to the Florida statute to see those. Okay. Director and supervisor levels for public health lab personnel follow the same as previously stated. 6.001 talks about how we do our applications and actually gives links now to those applications. 6.002 talks about what types of documents you have to have in order to apply for license. Really important that people understand that when you apply for a license in the state of Florida, you should be submitting diplomas and or transcripts, or, you know, if you have a diploma that clearly states it's a BS in biology, then you shouldn't have a problem. If you read the rules, we talk about different types of degrees. We run into problems if you present like a BS in geology. Well, that's not going to really help you unless you can prove that you have the necessary bio and chemistry courses that are needed. All foreign transcripts must be evaluated by one of the credentialing evaluations that we have listed in the board rule. Evaluations of transcripts are not required for individuals who have gone through accredited institutions in Philippines. The Philippines model of education is solely identical to the United States, and how they train their clinical laboratorians are exactly how we're trained in the United States. And a lot of their clinical laboratory accredited programs are actually NACLs. So individuals who come from Philippines really get their licensure rather quickly. 6.003 does allow for a temporary license under specific conditions. Board does and has issued temporary licenses to individuals. Usually these licenses are given with the understanding that other provisions have to be met before a full license is issued. 8.002 talks about inactive status and how to reactivate inactive clinical laboratory personnel licenses, and talks about the fees associated with placing your license in inactive status. Renewal of laboratory training program license, just like a personnel clinical lab license, it is also renewed every 24 months, and that is described in Rule 8.003. 8.004 is talks about and describes the renewal process for clinical lab personnel, which again, and this is in particular to the providers that actually offer CEUs, and like everything else, those are renewed every 24 months. 8.005 talks about what happens for delinquent licenses, meaning those individuals who do not renew on a timely manner. 8.006 talks about the exemptions that are in place, various exemptions for spouses of active military. And the rest, 9.001 through 9.011 talks about all the various fees that are related to maintaining the licenses. Some have to do with application, some do with activation, or what happens if you have to reinstitute it for various reasons, or what happens if you do not fulfill your CEU requirements, which is kind of difficult not to do anymore because you cannot renew your license without proof of your CEUs being complete through CE broker. 10.005 is the scope of practice relative to specialty. So this actually describes what a person can do when they hold a certain licensure level or a certain specialty on their license. What makes them eligible to practice under that license's scope of service, or scope of practice in our case. 11.001 describes the whole continuing education process. Who can, what is required of continuing education providers, what licensees are responsible for. We are responsible for a minimum of 1 hour in each category that we are licensed. We are also required to do 1 hour of continuing education on HIV/AIDS. A little note about that, we have tried for many years to remove the 1 hour of continuing education of HIV/AIDS, but unfortunately, unlike other boards in the state of Florida, this is actually put in statute for clinical laboratories. So what has to happen, it has to have a legislative bill put through. And as of today, we have no sponsor that would like to put a bill through the Florida legislature to remove the continuing education of HIV and AIDS from our continuing education rule. So it's not very easy for us to get this removed. We also have to show 2 hours of board-approved medical errors. The medical errors are very specific. It tells the rule actually explains exactly what has to be presented in the presentation. A little note about medical errors presentations. We do no longer accept medical errors presentations unless they speak about lab-specific issues. In the past, there have been medical error presentations put forward to the board, that really never even talked about the laboratory. In order to qualify for your 2 hours in medical errors, the presentation that you watch or attend must have specific lab pieces in it. I can tell you that every single medical errors presentation or CEU, before it is approved by the board to be sent out as a possible CEU for our licensees, it is actually reviewed by the CE committee of the board. And if we do not see a mention of laboratory specific topics, we deny it to be approved. We also have the 1 hour course in Florida rules. This is what you're doing now. If you're wondering why you're sitting hearing me talk at 7 o'clock in the evening. A little known fact, if you attend a board meeting, a face-to-face board meeting, that qualifies as your 1 hour course in laws and rules. I always encourage all of our licensees to try to attend a board meeting when they are held face-to-face. We haven't had a lot since COVID. They are starting up again. We're having at least 2 this year that are face-to-face. Those face-to-face board meetings qualify as your 1 hour course in laws and rules. Also, it's a very good educational process for you to sit and watch the board. You will learn a lot of things that you didn't realize that the board actually does, and you realize the types of things that could be presented to the board, not only individuals who are having issues with their application. That makes up the majority of the board decisions, and applicants are those individuals who don't really fit within the rule. So it's up to the board to figure out, okay, what types of things are they missing, and we cannot issue the license because of that, or they fulfill the rule by a different mean that's not necessarily spelled out in rule. The other major part of a board meeting is, like I said, disciplinary actions. So that seems to be very enlightening when individuals attend, because they didn't realize that individuals could have their licenses stripped during these meetings. There can be lots of other disciplinary actions done. They can be placed on suspension. They can be given heavy fines. So I always advocate that individuals try to attend at least one board meeting just to see what's going on and how their licensure process works in the state of Florida. If you hold a director or supervisor license, you also have to have 1 hour CEU in admin or supervision. You have to have a total of 24 hours of continuing education every 24 months before you can try to renew your license. Of course, this is all going through CE Broker. So CE Broker now, basically, if you can't prove your 24 hours, it will not allow you to renew your license. Initial applicants, meaning this is the first time they were ever applying for licensure, are exempt from the continuing education requirements for that biennium that they applied. Individuals that may add a specialty afterwards, after they receive their license, are exempt from the required 1 hour of CE in that category or specialty that they are obtaining. 11.002 are just the standards for the courses. Like I said, many courses go through what we call the CE committee of the board. They are reviewed, mainly the medical errors one, to make sure that they comply with the rules stated in 11.001. To be an hour continuing education, the presentation must be at least 50 minutes in duration. Okay, a little note about that, because we do see some courses trying to go through for 30 minutes. Those will no longer be approved unless there is a part 2 that must be taken for a total of an hour or 60 minutes. 11.003 through 11.005, again, is just more explanations about the CE program, what CE program providers have to do, how the provider process is done, and what the approvals happen, and talking about mandatory HIV and AIDS education for initial licensure or renewal. 12.001 through 12.006 are basically just explaining what are considered violations of statute or rule. All the disciplinary guidelines, the citations, all the fines associated with those disciplinary actions. 13.001 talks about the responsibilities of directors. 13.002 the responsibilities of supervisors, and so on. 13.003 are the responsibilities of technologists, and technicians are found in 13.004. So that is particularly the Board of Clinical Laboratory Personnel. A quick note about licensure for the actual laboratory itself. I think a lot of people get that confused. They think there is still a licensure for laboratories in the state of Florida. Well, that was discontinued on July 1st of 2018. AHCA, the Agency for Healthcare Administration, no longer oversees a clinical laboratory licensure for the actual laboratory. They now just require CLIA. So if your laboratory is a CLIA certified laboratory, then you are complying with the AHCA rules about laboratories in the state of Florida. Before July 1st of 2018, all laboratories had to have CLIA plus an AHCA laboratory license. And again, that was discontinued in 2018. However, one part of that rule that was related to point of care testing was not discontinued, but rather it was moved to the hospital AHCA rules. And in particular, that rule is 59A 3.242. If you go to that rule, it applies only to point of care testing done within the walls of a hospital. So that's where you see the point of care testing. When they discontinued the licensure process for clinical laboratories, there was no impact to your clinical laboratory personnel licensures, because our licenses are actually done through the Department of Health. Okay, so the Agency for Healthcare Administration is different than the Department of Health. They're two separate entities. The Agency for Healthcare Administration, or AHCA, was the one that issued the licenses for the laboratory. They no longer do that, but they do still oversee point of care testing within a hospital. Here are floridaclinicallabs.gov. That is the actual website for the Florida Board of Clinical Laboratory Personnel. It is a wealth of information, this site. It gives you links to the statutes and rules related to the profession. It gives you all the board meeting schedules and agenda and minutes. It goes back, I think, 3 years with the minutes. They are recorded now, so you can actually sit through a recording of the board if you would like to do that. It also gives you links to all the requirements and license renewals. Are there any questions? I can't see the chat in this mode, so if the moderator can let me know if someone has their hand up, or is there a chat question?
Absolutely, Linda. It looks like there are no questions in the chat. I don't think at this time. Thank you so much for that talk. That was a lot of information in a short amount of time, so thank you. So we'll open it up for questions for Linda. Anybody, you can type it in the chat, or
Dr. Hada, I think, has her hand raised from what I can see on my end.
Of course, I have a question. Thank you very much. So I was wondering if you could tell us why licensure for public health personnel is separated out from everything else.
The technologist and technician level of public health is, like I said, and you are correct, it is actually put in statute. There is no rule related to it. I do not personally, no, I don't think anybody else on the board can tell you the history of why that is. I can tell you that the statute related to technologist and technician level for public health, the requirements are less than the clinical laboratory technologist and technician.
When you say requirements, do you mean academic requirements or training?
All. there is, and I don't have I would have to, I'm going to stop sharing so I can maybe find the rule for you, but they do, it has, a lot of it's specific to micro, so that is a good question. So you have a lot, and that is really the reason why that is because you have the state laboratories, so it makes it easier for individuals that just have a micro background but don't necessarily have the clinical laboratory experience or have gone through a clinical laboratory training program per se to work in a state laboratory, because that really isn't needed to work in a state laboratory. So we want to make sure that those laboratories, the public health laboratories, are getting covered. Does that answer? It's a good question, though.
Yep, agreed, and thank you.
Ramona, I believe, has her hand up.
Hi there. I'm
Hello.
Ramona. I'm the program director for the UF Health School of Medical Laboratory Science. And, I have a question. I don't know how familiar you are with the CLIA rules, but I've had a couple questions brought to me about 2-year techs that maybe have their AAB license not being able to perform competency assessments, like to do those evaluations. Are you familiar with that?
Yes. CLIA is very specific. In order to do competency assessment, you must have a BS degree because that qualifies you as technical supervisor under CLIA. You can be a general supervisor with an AS degree. However, to do competency assessment for non-wave testing, we're not talking about wave testing, we're talking about moderate complex or high complexity testing. In order to do that, you must prove a BS degree with certain amounts of bio and chemistry. And I believe it's 4 and 4 under CLIA. So that is a sticking point with a lot of individuals who have technologist level licenses in the state of Florida with an AA or an AS degree, but that does not automatically say they can do competency assessment. They can't if they have a BS degree. The other problem that we are encountering that is in CLIA, and it's also in Florida rule, the BS degree has to be in either biochemistry or something related to bio and chemistry. So it can't be in geology, it can't be in environmental testing. So, and then a lot of individuals went back when CLIA started enforcing this part of CLIA. CLIA went down really hard on the accreditation entities related to competency assessment in this particular CLIA regulation. A few years ago, about going on 10 years now when this happened. So a lot of individuals who had AS degrees said, oh, we'll just go back and get a BS degree in health services administration. Well, that doesn't count because it's not a biology or chemistry. And again, that is under CLIA regulation. So it is not a Florida thing. That is actually what we in the business call, in regulatory speak, we call that a CLIA foundation regulation. The fact that you have to, in order to be a technical supervisor, you have to have a BS. There's really no way around that. You can be a general supervisor, which is, we look at it for like a step down with an AS degree. So a technologist with an AS would be appropriately a general supervisor.
Okay, yeah, I had looked at it a little bit differently, I guess, because I was looking at them and it seemed that the technical supervisor could delegate that activity to a general supervisor as long as the general supervisor met the qualifications of a technologist. So
they can give it to a general supervisor if they meet the qualifications of a technical supervisor, which means they have to have a BS degree. Okay. And if you you add on top of that, if you are Joint Commission Lab, CAP, COLA, they all have to require that because again, it is a CLIA foundational regulation.
Okay, and if I may ask one more, in terms of the BS degree, now if it doesn't say biology, like I have applicants that I've got one that has a degree in pharmacy. She has so much chemistry and so many different varying types of biology. Is that degree going to go for review?
If they're applying to the state of Florida for a license, it will probably go to review. I can't tell you for sure if it will or not. What the board office does look at is the amount of bio classes, academic bio and academic chemistry that they do have. Remember, it's 6 with a total of 24 academic. So again, sometimes they send to, what happens is those applications go to the credentialing committee, and the credentialing committee of the board will determine whether or not it has to go to full board review. If they see that they have the appropriate amount of education based on their credits, doesn't have to be based on the degree, they may or may not pass it through. But
Okay.
I can't speak for the credentialing committee members.
Do you know, like I have some students that have biomedical degrees, and there's been some discussion about them not being able to do competency assessment, even though biomedical is actually a biology degree. Is there anything that you're aware of pertaining to that?
For competency assessment, again, it would go back to how much bio and chemistry they have.
Well, they would
And
have plenty. They would have plenty.
And if they have it, then they shouldn't be an issue.
Okay,
But
yeah,
I wouldn't be able to speak to any particular.
yeah, as far as CLIA goes, yeah, I got it. Okay, all right.
But you also have to remember too that CAP, COLA, Joint Commission Lab also, they basically reiterate the CLIA rule about this. However, some of them might put a little tweak on it and actually make it more difficult. So just keep that in mind. So they can make it a little stricter.
Okay.
I know CAP really controls that. So, but usually if they can go back and prove that they have the amount of bio and chemistry, and again, they not only have to fulfill CLIA, but they also have to fulfill the state of Florida rules.
Okay. All right. Thank you so much.
Of course.
All righty. Any other questions for Linda?